Our next segment, we're going to get into the psychological impact of athletic injuries, specifically for athletic trainers, things that we need to know. And a great presentation at NYSATA 2022 with Frank Alexander, who is the athletic trainer in the office with Dr. Christopher Ahmad, who's the New York Yankees team physician working at Columbia University Medical Center. Frank, thank you so much for being here and for this recap. And really want to dive into this psychological components of what we can do and the role we can play. And first and foremost, you really got into the research in the beginning, and the studies that interviewed athletic trainers, the studies that were done about how we generally lack the confidence in the area of psychological aspect of injuries and helping athletes cope with injury. We want to help them. We wish for further training, but we really have a need. Let's dive into that a little bit more. And what have you found in your research?
Well, Ryan, thanks so much for having me first and foremost. It's a pleasure to be connecting with you and on your podcast. I really appreciate everything you've done for the profession as a whole here. So in terms of what athletic trainers want to know, the one thing that even as an undergrad that I really understood was injuries happen. And that is just, it's something that you understand as an athlete moving forward. There is no sum zero risk of never getting injured. Every time a soccer player steps on a field, there's a risk of tearing their ACL. Every time a baseball player toes the rubber, there's a risk of tearing their UCL. So for us as athletic trainers, I think it's really important for us to know that, hey, there is a physical side to this, but the mental side is something that, unfortunately, I think, in my opinion, up until within the last, I would say 3 years or so, has really fallen by the wayside. A lot more research, a lot more high profile athletes. And most recently was Simone Biles a couple of years ago at the Olympics talking about the twisties. I think for me, when those athletes started really speaking out, it really shifted the dynamic and made us as healthcare professionals really become a little bit more introspective and say, hey, how can I help these kids that may be putting on that stoic face? They're rock solid, but when they go home, they are a mess.
And that's crucial, that not only do we have to be aware enough and trained enough to be able to catch those signs and symptoms that we see in our athletes, but we also saw it firsthand going through this whole phase of COVID and this pandemic issue over the last couple of years. What specifically, when it comes to the psychological impact of COVID on athletes in terms of identity and just being shut down? What's the stuff that you've seen in the research?
So you're taking kids that identify as athletes. And as I said in my talk a couple of days ago during the meeting, was that I'm in my 30s and I still identify as a baseball player. It's something that you just do. And so when you take kids that are still in their prime years of playing and you remove them from that environment with their best friends, their peer group, that is everything about their life. And now you have completely removed them from it. And not only that, they're not just not allowed to play. You can't leave your house because everybody's quarantined. Yeah. So you're taking major dramatic shifts that are just snowballing with these kids. And it impacted everybody. It doesn't matter if you were a high school or college athlete, it's impacting everyday healthcare professionals. Dr. Ahmad was redeployed back to the OR, the emergency rooms. They shut down our ORs. They said, hey, you've been practicing orthopedic surgery for the last 20 years. Good. You're still a doctor. Head to the ER. We need you on a shift. It's for him. He talks about it frequently. It's one of the most humbling experiences he's had as an orthopedic surgeon. But what we're seeing with these kids, and we studied over 500 athletes of all different playing levels and sports. What they're seeing is that the higher their athletic identity, the higher depression scores that they had. So the more you identify as a lacrosse player and now you're removed, the higher likelihood you are of having depression. So, and then when we looked at physicality, we found that about 85% of athletes were able to maintain some level of athleticism. They're able to do their training, but they weren't able to do maybe as much sports specific training as they would have liked to. So that was pretty impactful as well. The big thing that I think we really found out was that the female athletes actually found or felt that they were more physically fit, but they were more depressed. So again, we're taking just males and females, looking at them. The males had actually lower feelings of physical readiness to return to play, but the females had higher scores of risk depression. So those are two big things that we found with those stratifications. I think one of the other things that we looked at in that study was what players' fears were. And a lot of them were afraid that they weren't ready enough to return to the field, the pitch, the court, wherever. They felt that they had the time to get physically ready, but they just weren't they felt that they weren't physically ready despite all the training that they did.
And you alluded specifically, I believe the number was like 47% felt they weren't prepared to return to sport, and like 41% thought they were already at a higher risk of injury. When that's in your mind before you even get out there and return to that high level, that's a psychological disadvantage. And that is, you're going to have kinesiophobia, you're going to have challenges, you're going to hold back, you're going to hesitate. And that created a lot of issues, as we saw with return to play, not just for the deconditioning, but also the psychosocial aspect of it.
Yeah, definitely. And another part of that is it's almost 50%, which is staggering. But I remember when I played football in high school, my coaches always said, if you shy away, the more afraid you are of getting that hit, the higher likelihood you are of going to be getting injured. So when you're able to play at 100%, whether it is 100% mentally, 100% physically, look, we know that these college and high school seasons are a lot longer than they were 10, 15 years ago. So nobody's ever going to be playing at 100% all the time. Mm-hmm. But we hope that they're at a functioning level where they're not at higher risk for injury.
Absolutely. And some great tools out there to help us as athletic trainers and any healthcare provider assess that psychological readiness and that psychological state. You mentioned a number of different measurement scores, the Tampa scale of kinesiophobia, the athletic identity measurement scale. Can you talk about those and kind of which ones you really leaned on, which ones were a part of your study that we can look into and potentially implement ourselves?
Yeah, so the first one with the COVID study was the AIM score, the athletic identity score, and anything greater than 50 shows a higher incidence of athletic identity. So if you score 50 or above, that is, you feel that you identify as a baseball player, as a lacrosse player. So that's the one score. That's just blanket. How do you identify? Do you identify as an athlete in your sport, or do you not? The other measurements that we use specifically in our UCL and ACL psychological impact studies are the IESR, which is the Horowitz Impact Scale of Events, and which is revised, so that's what the R stands for, and then the Tampa scale of kinesiophobia. So the impact scale the IESR is a 22-point questionnaire that I give to athletes, and it takes them probably about 5 minutes or so. It's pretty streamlined. It's a scale of basically, when I score it, it's 0 to 4 points, but the questions are answered either not at all, somewhat, extremely, all the time. So, or some variations thereof. I don't have it right in front of me, unfortunately, but the higher you score, the higher risk you are at for having PTSD and future immune system compromise. So in our UCL score, we were looking at the data just last week, and as of right now, we have just under 100 players, and the highest score out of a possible 88 is 61. And as I mentioned in my talk, I'm a little worried about that athlete. We did see him about a week after his surgery, and he seemed to be in a much better spot, but it's definitely a kid that I'm going to keep in the back of my mind every time he's in the office. Like, and subtly, I don't want to call him out on it because maybe it's not something he wants to do with the people that are in the room, whether it's mom, dad, a significant other, whatever, but do it just, hey, how you feeling today? Kind of conversation. And some of these kids will actually open the door. And once you get just a little bit of a purchase point there, maybe they'll just blow it wide open for you. And then you just have that really good open dialogue. Obviously, as athletic trainers, we know that we have to have that good rapport and relationship with our athletes, which we all do, but it's just a matter of when is it time for that waterfall to really hit.
And that's a key point, is that rapport that you build that opens the door for trust and opens the door for, demonstration that you're truly listening and caring about what they want to say, so they don't have to have a wall up. If you can't get through that, you're going to have a difficult time getting to the next level, What are some action steps for athletic trainers? You specifically mentioned sort of a three-step approach with education, introducing mental strategies, and the application of the skills. But what can we do? How do we attack this to really make a difference?
So I think one of the first things in terms of education, what we do is we educate that not only is this a physiological injury, it's also a psychological injury. Just using UCL injuries and Tommy John surgery as an example, that's a year-long recovery.
Yeah.
You're missing a full year. You're with your friends in the dugout. Maybe you're hanging around, but you're not necessarily in the dog piles 6 weeks post-op because you're still in a brace. So you're there, you're celebrating your friends and your teammates' successes, but you're not contributing, unfortunately. So educating them that, hey, look, this is physical. You're going to get through the physical part, and that's why we're here for you. Dr. Ahmad has actually started calling me his Tommy John surgery coach, because if these kids are having an issue, I'm their go-to guy. I need to make sure that they're in the right physical therapist at the right time and that everything is streamlined, especially for college kids that are coming home. So this is a very long process. And looking at on the other side of ACLs, it's still about a 7 to 9 month recovery before you're back in a game. So, and then at that point, they're wearing a brace. We recommend that they wear a brace when they return to play, at least until the 1 year post-op. So there's a psychological component like, hey, why are you sending me back with a brace? I thought my knee is supposed to be rock solid. So there is that. So that's all a part of education. It's from you got injured and here's our solution to, hey, I've recognized that this injury is not just affecting you physically. And I'm here for you if you want to talk about it. If you don't want to talk to me, I have resources. The second part, as you mentioned, is that kind of developing those strategies that we can use to help those athletes cope with whatever injuries they have. And one that we typically use, and I talk to a lot of athletes about, is visualization. It worked for me as a player. It actually works for me now as an athletic trainer when I know that we're going to be seeing a heavy caseload of patients during the day. And I look at the caseload ahead of time and I know maybe who I need to spend a little bit more time with. Who are those kids that are having those issues, whether it's physically, maybe their range of motion isn't where they need it to be following surgery, or maybe it is a psychological component of injury that I need to just give them a little bit more of a personal touch and a little bit, I don't want to say hand holding, but something along where they just need a little bit more TLC. And we all know who those athletes are in our training room. But visualization, I think, is one of the greatest ways that we can help our athletes. And it's something that, in my opinion, is with a little bit of practice, it's fairly easy. It doesn't take a lot of brain power. It's not something that you have to really hone in. A lot of athletes already do it. They're visualizing themselves on the next play. What if I'm in the outfield and a ball is hit to me? What if I am a soccer goalie and I see the ball go far on the right side, but now it's crossed to the left? Where am I going next? So everybody's always thinking about next steps. That's where I think visualization is super helpful. And the third step is applicating it. How do we apply all of this information that we're teaching an athlete? It may even be in a 45-minute training room session. How do we take it and make it tangible? How do we help them kind of hone in everything that we're working on in the athletic training room, whether it's range of motion, strengthening, quad sets, straight leg raises, something as simple as low load, long duration stretching that they're going to be doing at home? And how do we help them really apply these things into what they're doing? And maybe it's a homework assignment, or as I said in my talk, maybe it is, you know what, we have 45 minutes and while you're on the game ready today, I want you to think of and visualize your next session, how you're going to be better with your single leg squat. Which I think is fairly easy. Again, I've never injured my ACL, I've never torn, I've had knee and I've had quad injuries, but I've never had a significant injury, but have been sidelined. So I understand where a lot of these kids are coming from, where you're kind of off to the side, but how do we make it for them where it's easy? I think that's one of the biggest things. There's a couple of things I tell all of our athletes in the office. And when they ask me, what should I do about my athletic trainer or my physical therapist? If you are lucky enough to have a huge athletic training staff, I tell kids, find the trainer that you like the most, or the physical therapist you like the most, and the one that treats you the way you want to be treated. Because if you don't like them and they're not treating you the way you want to be treated, you're not going to go. And then that road just becomes longer and longer.
Absolutely. And I think just to sum this up, it's It's not that we as athletic trainers have to have all the answers or know how to address the psychological aspects that are popping up in these measurement tools or in our observations. It's just that we're removing barriers to allow us to get through to that athlete, or for that athlete to communicate with us, so that we can direct them to the right person to get that help, to build that bridge for them. So thank you so much for talking about this topic. I really appreciate how you dove into it and your perspective with this, and taking some time to recap it here on the podcast.
My pleasure. Thanks so much again for having me.
You're welcome, Frank. Have a great night.
You too.